Now, today we'll start off with the other types of non-experimental design. Yesterday we did survey. Today we'll do what is descriptive design, and hopefully we'll also get into correlational design. Now, descriptive designs are those studies, or the descriptive designs or descriptive studies are used when researcher has limited knowledge about a phenomena. You do not completely know about something, and you would like to observe it. You would like to describe and document whatever you are finding after observing a particular phenomena. Okay, यहाँ पर variables are not manipulated. Okay, and your research is not focused in finding what is the independent variable, what is dependent variable, and you're not trying to find cause and effect. Okay, what is the cause, what is the effect of that cause? वो पूरा आप try नहीं कर रहे, find करने की कोशिश नहीं कर रहे. You're just trying to observe what is happening, and you're trying to describe what is happening. Okay. In this study, you describe what exists and its frequency of occurrence. Okay, how many times does it occur? Let's suppose you are studying uh, appearance of one particular season in a year. Okay, let's suppose you are studying appearance, or let's suppose appearance of rain during summer. Okay, how many times does it rain in summer? Does it rain altogether? If it rains, how many times does it rain in a year? Okay, and you are seeing over the years. Let's suppose you are seeing for a period of 10 years. वैसा, ठीक है, you're simply observing a phenomenon and you're studying it. You're trying to understand a theory, and you are trying to develop a theory and understand a phenomenon in this. Now, there are three different types of descriptive designs. The first one is called univariate studies. Univariate studies में जो है, these will involve, they may involve multiple variables, but the primary goal of this study is to describe the status of each variable. You are not relating those variables to each other. You're not trying to establish a relationship between those variables. इसकी वजह से ये हुआ या उसकी वजह से ये हुआ. You're simply trying to study different types of variables in univariate studies. Okay, individually study all the variables. Now, univariate studies have two types. There are prevalence studies, okay, and there are incidence studies. So these are two important concepts in research: prevalence and incidence. Okay, they may seem similar, but they are different. Now, prevalence is essentially you're trying to measure the prevalence, how prevalent that phenomena is. How many times does it occur at a particular point in time? This is essentially cross-sectional study. For example, let's suppose you are trying to find out prevalence of diabetes in India in 2019. ठीक है, या अब वैसा कर रहे हैं essentially. So, prevalence of let's suppose one particular condition at a point of time in one time frame, आप कितने cases है या कितना number है. Let's suppose you are trying to find out total number of HIV patients. क्या बोलते हैं, total number of HIV patients in 2009, ठीक है, or in 2019 or 2020. At one point in time, you are trying to find out what is a certain phenomena, what is the number that is associated to a certain phenomena. That is prevalence. Incidence जो है, this will measure frequency of developing new cases. Meaning, incidence of, अगर समझो, incidence of same case ले लो, incidence of HIV cases in 2020 and prevalence of HIV cases in 2020. इसमें difference क्या आता? Prevalence में जो है, आप एक particular time पे you are only measuring how many cases are present in 2020. In incidence, you are seeing how many new cases have come in 2020. ठीक है, prevalence में you'll also account for the old cases. ठीक है, अभी already people who are suffering from HIV, you'll also account for those cases. ठीक है, there might be people who are suffering from HIV since 2000. ठीक है, so all the cases prevalent up to this point, meaning up to 2020, from whatever point, ये point of time में कितने लोग HIV से affected है, that will be prevalence. Incidence will be how many new cases of HIV have come in 2020. Meaning, let's suppose the total prevalence of HIV by 2020 is about, let's suppose, 1.5 lakhs in India. Example. Okay, there are 1.5 lakh people of HIV in 2020. How many new cases of HIV have come in 2020? That will be the incidence. Okay, so let's suppose this is around 5,000. ठीक है 5,000 10,000 whatever it is number. यहाँ पर incidence में you are only measuring the frequency of developing new cases. ठीक है, this is a longitudinal design. Generally incidence is done for a year. More often than not, it will be done for a year. What are the new emerging cases of one particular condition in that year? ठीक है, those will be incidence. Prevalence will be how prevalent that condition is. How many people are getting affected by that condition at that point of time in 2020 or any point of time. Let's suppose in May, how many people are getting affected by sunstroke? In summer, how many people are getting affected by sunstroke? Versus incidence कैसा रहता? In that year, in this season of summer, how many people, how many new cases of sunstroke came? वैसा, ठीक है? All of that. So that is univariate studies. Then we have, if you didn't understand that, please feel free to ask me. Okay? You can stop me at any time and ask doubts. Then we have second type, which is exploratory design. Okay. In exploratory design, this is essentially used to identify and describe the existing phenomena. You're doing this in depth, okay, and you are exploring its related factors as well. For example, let us suppose you are trying to study fall. Okay, fall in the sense literally people falling down. Okay, you are trying to assess multifactorial dimensions to fall. You are performing a study where you are assessing all the different factors that may cause a patient to fall down. Okay, and you are trying to find out what related factors can improve the likelihood that they will not fall. Okay, essentially, let's suppose you are trying to find out how you can improve home safety measures for elderly people in certain communities. Okay, let's suppose elderly people may include कर रहा हूँ, people who are over 70 and they might have several reasons of fall. Okay, they might have low blood sugar or they might have what do you call several reasons. They might have diplopia, they might have what do you call poor this thing kinesthetic sense, or they might not be able to walk properly, they might trip, their sense of balance might not be proper. बहुत सारे reasons रह सकते हैं fall के लिए. So in that exploratory design, I'm only stating a sentence called, I'm only stating a word called fall. अब वो fall से related कितने कितने scenario है, how what are the many ways through which an elderly person can fall down. I'm trying to study that, and I'm trying to come up with ways where I can decrease the incidence of that fall, essentially. Okay. So those are the second type, exploratory designs. Then we have comparative descriptive design. Now, this is used to compare two different groups. Okay? You can compare them based on knowledge level, you can compare them based on perceptions, or you can compare any two attributes at one point of time. Okay? The researcher might contrast two or more samples of subjects, okay? Based on one or more variable. आप compare कर रहे हैं. For example, let's suppose you are trying to compare health of older people, okay, between rural and urban settings. Okay. So general health outcome, general quality of life. Okay, you take several variables in them. What is their body weight? What is their what do you call cholesterol level? बहुत सारे अलग-अलग parameters there हैं. What is their VO2 max? How is their quality of life? Are they happy? Are they depressed? क्या हो रहा? ठीक है. अब थोड़े scales administer करके, you are generally seeing what is the difference in health between what do you call elderly people who are living in a rural setting, and elderly people who are living in an urban setting. Okay? What are the health problems that they face as well? So, for example, let's suppose you find out that people who live in rural settings, they might have a different set of health problems altogether, and they might not have any, or the incidence of chronic problems like diabetes or hypertension might be lower in rural setting compared to urban setting. So you can conclude, this is only an example. Okay, you can conclude that people who are living in urban settings have more stressed life, or whatever the reason, they are essentially living a lifestyle where they are moving towards more chronic diseases over a period of time, meaning from their young age to their 40s and 50s, then finally to their older age. They are essentially acquiring, more and more people are acquiring diseases like hypertension or diabetes or things like that. Okay. Whereas people in rural settings, उन लोगों के अंदर उतना common नहीं है. Maybe in rural settings, infections are more common. Example, okay, a certain type of something is common with other than chronic infection. Okay, तो आप वैसे compare कर सकते हैं comparative descriptive design. Then we have, so that concludes descriptive design. I hope you understood. So univariate design में क्या है? आप जो है multiple variables को पढ़ रहे हैं. It will involve multiple variables, but the primary goal is to describe each and every variable. Then we have in that two types: prevalence and incidence. Prevalence will be the total number of cases up to that point. In one point of time, कितने cases है total. Incidence will be total number of new cases that are emerging in that particular point of time. So let's suppose in that same year 2020 में कितने cases of HIV already है versus 2020 में कितने cases of HIV नए आए, ठीक है. Then we have explanatory design where you are simply trying to identify and describe a phenomena in detail. Then I give you an example of fall. So you have older people who are falling because of various reasons, and you are trying to find out, trying to come up with ways where you can account for all of these causes or maximum number of these causes, and you are trying to avoid these causes. Okay, or come up with ways where these people can avoid those causes. Then there is comparative descriptive design. Comparative descriptive design में आप क्या कर रहे हैं, दो particular phenomena, दो group ले रहे हैं and एक particular attribute पे दोनों को compare कर रहे हैं, ठीक है. For example, health problems in rural and urban settings. So that is descriptive design. Then we have correlational design. Now, in this, you are taking the scores of subjects on two variables, okay? And you are taking the scores and you are measuring them without manipulating any variables. You are simply trying to find out the relationship, okay? In this, the relationship is found out or it is examined between two or more non-manipulable or non-manipulated variables. यहाँ पर आप variable को manipulate नहीं कर सकते. You are just trying to find out what is the relationship between those two variables and how it is affecting the subject. ठीक है. Now the researcher can examine the strength of that relationship as well. Strength of the relationship का मतलब ये रहता है कि if you are changing one variable, what is the extent of change in the other variable? एक की change कर तो मैं दूसरा कितना change हो रहा और change हो रहा नहीं हो रहा क्या हो रहा, ठीक है. This is not a causal relationship. You are not trying to find what is cause and effect. This is an associative relationship, ठीक है. You're trying to find out what is the association between them rather than trying to find out cause and effect. For example, correlational studies में कौन से आते हैं? What is the relationship between height and weight? Example, अगर height बढ़ी तो generally body weight बढ़ता क्या नहीं बढ़ता क्या होता, ठीक है. या on the other hand, weight बढ़ा तो height भी बढ़ना जरूरी है क्या, या फिर birth order and years of education, ठीक है. Based on the order at which you are being born, let's suppose there are 5 brothers or 5 siblings, ठीक है. And उन लोगों के different birth order है. For example, one is born in 1990 and another is born in 91 or 1991, then 93, 96 and 98. So you have 5 children who are being born at different ages. तो ये birth order जो है उनके total years of education पे affect कर रहा क्या, meaning let's suppose someone who is born in 1990, are they studying more than people who are born in 1998? I do not mean basic schooling and graduation tak. In the sense that, see, basic schooling से graduation tak, let's suppose it is about 21 years of total education or 18 years of education from 3 to 21. ठीक है, वो common है पूरों में. But after that, are they studying? Does it matter? Are people from the 90s और 1990 के जो है उन्हें ज्यादा पढ़ रहे कंपेयर टू 98, या 98 वाले ज्यादा पढ़ रहे कंपेयर टू 1990? ऐसा आप कोरिलेशन देखने की कोशिश कर रहे हैं. या एक और एग्जांपल रह सकता है, cigarette smoke per day. ठीक है, the total number of cigarettes that one person is smoking per day, and healthcare costs. Do they have higher healthcare costs if they are smoking more number of cigarettes? So let's suppose there are two people. Let's suppose they are A and B. One person smokes 10 cigarettes per day, and the other smokes 5 cigarettes per day. Okay. Now, keeping everything else constant, are the healthcare costs of this person higher than this person? ऐसा आप कुछ relationship बना सकते क्या? Meaning that by the end of the research, you'll be able to conclude that if you're smoking more number of cigarettes, there is a higher chance that you will increase the damage that you are dealing on the person's body. Or is there no relationship altogether? आप वो establish करने की कोशिश कर रहे हैं. Now, in this, it's slightly difficult to identify what is the dependent variable and what is the independent variable. Okay? But you will try to find out what is the relationship between independent and dependent variable without manipulating altogether. You will not manipulate the variables in this. Okay? Another example would be, let's suppose you are trying to study correlation between study habits, okay, and visual acuity. Visual acuity can be understood as visual acuity is essentially a sense wherein you are seeing detail. Okay? Detail in any particular subject or detail in anything for that matter. Are you going into depth and are you seeing the minutest details? उसको visual acuity बोल सकते हैं. It does not mean only related to any subject. You can see any pattern and things. उसको भी visual acuity बोल सकते हैं. If you are seeing a set of numbers, are you able to find out the pattern in between them? That is also categorized as visual acuity. So you are trying to find out, let's suppose among children who are studying in certain schools, you are trying to find out, is there a relationship between the habits that they have for studying, okay, whatever study habits they have, and their visual acuity. So यहाँ पर independent variable will be study habits, this visual acuity will be dependent variable. ठीक है, so depending on their visual habit, they might develop better visual acuity. Certain study habits might force them to become more observant of things. Okay? Even when they are reading a book, they might be able to, observe what is important, what is not important. They'll be able to capture key points or grasp key points much better, depending on different study habits. And you're trying to see the relationship between them. Maybe certain study habits are better for studying and certain study habits give better visual acuity compared to others. You're not manipulating any of them. They are free to use any study habits and you're not messing with their visual acuity. You're not helping them in any way. You're just seeing what happens with the students over time. Okay? Now, coming to types of correlational study or types of correlational design, there are two main types. Okay? So, one is prospective research design. Then there is another one which is retrospective. Now, prospective research design is you start with a presumed cause. Okay? For example, how should I put it? In this, what happens is the researcher relates present to future. Okay? You are seeing prospectively. You are seeing the effect of something that is happening now into the future. For example, let's suppose you are trying to study occupational hazard, the effect of occupational hazard on health of occupational workers. For example, let's suppose there are people who are working in asbestos factory. ठीक है. Let's suppose there is a new employee who is coming today and he's joining the workforce in an asbestos factory. And this is day zero. Okay. Let's suppose it is generally known that it is common knowledge that people who work in asbestos factory, asbestos generally, once it is inhaled inside, it will go and line inside the lungs and it will cause lung damage. Okay. Later on, if it goes on for a long period of time, it can cause cancer as well. But essentially, you know that asbestos can cause lung damage. So, आप क्या कर रहे हैं? This is an occupational hazard. They they have very little control over it. They can wear masks and all, but a few particles will go inside. तो asbestos factory में काम करने वालों की health कैसे affect होगी if they are working in that asbestos factory? Let's suppose you are measuring their lung capacity by VO2 max. ठीक है, आप VO2 मैक्स मेजर कर रहे हैं एंड आप क्या कर रहे हैं, वहां से आप कोई भी एक टोटल लंग कैपेसिटी मेजर कर सकते हैं या VO2 मैक्स मेजर कर सकते हैं या कोई और लंग वॉल्यूम मेजर करके लेट सपोज यू आर री एग्जामिनिंग दैट सेम व्हाट यू कॉल दिस थिंग आफ्टर 60 days. Let's suppose if all else remains the same, their lifestyle is the same, they are not doing anything extra or anything that can change their VO2 max, and after 60 days you are measuring the effect of this working in asbestos factory in that patient. So prospectively in future you are trying to predict. Let's suppose before starting the study, you are telling that now this person is starting to work in asbestos factory, right? That fellow's VO2 max will go down if all else remains the same. You are making a prediction for the future. Okay. These are often longitudinal studies, but they might be cross-sectional as well. Longitudinal मतलब over a long period of time you are doing the study. Cross-sectional का मतलब एक point of time पे आप check कर रहे हैं, फिर आगे एक और point of time पे check कर रहे हैं. ठीक है, आप longitudinal में क्या रहता, let's suppose ये same longitudinal करा मैं, तो 0 पे check कर रहे हैं, 10th डे पे चेक कर रहे हैं, 20th डे पे चेक कर रहे हैं, 30th डे पे चेक कर रहे हैं, ऐसा चेक करते जा रहे 60 तक. क्रॉस सेक्शनल में कैसा रहता है, 0th पे चेक कर रहे हैं एंड फिर 60th पे चेक कर रहे हैं, एक पॉइंट ऑफ टाइम पे चेक कर रहे हैं, एक पॉइंट ऑफ टाइम इधर, एक पॉइंट ऑफ टाइम उधर, तो पहले का और बाद में का देखने के लिए. ठीक है. Now another example for the same type of a prospective study would be, let's suppose you are trying to see effect of infection in pregnant women. Okay. Now let's suppose there are a few pregnant women that you see who have been suffering from infection, and you are trying to find out what will be the effect of maternal infection on the fetus. Okay. Over the years, once pregnancy is done, over the months specifically, what is happening to fetal development? Okay. Once the fetus is born, are they developing normally? Is there any abnormality? Do they have any deficiencies? Or is there something wrong with the fetus if this mother had an infection? Okay. Now, in certain cases, you might also include previous infections. Okay. You might link the present phenomena to past events as well. मतलब अगर let's suppose fetus को प्रॉब्लम आ रहा, आप यहाँ पर ये भी बोल रहे हैं कि उनको इन्फेक्शन आया था ना मदर को ड्यूरिंग प्रेगनेंसी, इट माइट बी बिकॉज ऑफ दैट. आप वैसा प्रेडिक्ट कर सकते हैं प्रोस्पेक्टिव रिसर्च डिजाइन में. रेट्रोस्पेक्टिव विल बी उल्टा. यहाँ पर आप कॉज से इफेक्ट क्यों जा रहे हैं ना, दिस इज द कॉज, दिस इज द इफेक्ट. Fetal development problems will be the effect. Cause is infection in the mother. In retrospective studies, you are doing the opposite. In this, you are going from effect to cause, meaning you already see cases who have, let's suppose, a problem in fetal development, and from there you are trying to find out, did they have problems? Did the mother had problem in the pregnancy? आप ऐसा उल्टा जाने की कोशिश कर रहे हैं retrospective design में. Let's suppose एक और example दिया मैं तो. Okay, let's suppose there are people who are coming with traumatic head injury. Okay. Let's suppose you are working in a NICU, neuro ICU in a hospital, and you go inside and you try to find out how many traumatic head injury people are there. Okay. Let's suppose in that whole NICU, there are 10 people who have a traumatic head injury. Okay. Where they are admitted in the NICU and they have to be monitored at all times. Now, out of these 10 people, you as a researcher are trying to find out how many of them had a history of drug abuse. तो यहाँ पर आप क्या correlate कर रहे हैं? It might be correlated that because they were abusing drugs, especially while they were driving or because of whatever reason, they ended up having a traumatic head injury. आप ऐसा correlation develop करने की कोशिश कर रहे हैं. आप past events के साथ relationship create करने की कोशिश कर रहे हैं. You already know that there is a certain effect. That effect is traumatic head injury. From there, you are going backwards and you are trying to find out whether that patient had some kind of a problem or not. ठीक है? So there is that. Now, आपके जो है retrospective design can be of two types. It can be explanatory design, or it can be prediction design. Explanatory design में जो है, the researcher is looking for simple association between variables, and they are trying to investigate the extent to which these variables are related. How much are those variables related? मतलब उसकी covariance देखने की कोशिश कर रहे हैं. तो एक वेरिएबल चेंज कर रहा तो दूसरा वेरिएबल चेंज हो रहा नहीं हो रहा. ठीक है, तो ये retrospectively कर रहे हैं आप. Maybe in the sense, let's suppose traumatic head injury में ही ले लिए. Maybe if you would have decreased drug abuse, or you would have caught drug abuse initially, there might have been a chance that the patient did not suffer from the traumatic injury. ठीक है, वैसा आप अगर एक फैक्टर चेंज करें तो दूसरा फैक्टर चेंज हो रहा नहीं हो रहा, क्या हो रहा, ऐसा आप चेक कर रहे हैं. प्रेडिक्शन डिजाइन में आप क्या करते हैं? द रिसर्च एसेंशियली इज designed to identify variables that will positively predict outcomes, in the sense that you are कैसा बोल रहा. Now, in this, you are trying to predict certain outcomes, specific outcomes. एक वेरिएबल देख के, एक वेरिएबल प्रेडिक्टर रहता, दूसरा क्राइटेरिया रहता. तो आप प्रेडिक्टर को चेंज करें तो क्राइटेरियन वेरिएबल जो है वो चेंज हो रहा नहीं हो रहा. दे आर वेरी सिमिलर बट स्लाइटली डिफरेंट. एक में यू आर सिंपली ट्राइंग टू एक्सप्लेन. ठीक है, इफ आई चेंज वन वेरिएबल डज द अदर वेरिएबल चेंज. इन प्रेडिक्शन में आप क्या कर रहे हैं? एक वेरिएबल को चेंज कर रहे हैं एंड यू आर प्रेडिक्टिंग दैट देयर विल बी चेंज इन अनदर वेरिएबल. ठीक है, एक्सप्लेनेटरी डिजाइन में यू आर ट्राइंग टू फाइंड आउट दैट if I change one variable, will the other variable change? In prediction design, you are trying to find out if I change one variable, you're trying to predict essentially. If one variable, if I change, let's suppose you are telling that if I change one variable, another variable is also changing. ठीक है, वैसा. अब ये retrospective में कैसा करते हैं आप? In the sense that, for example, use of anti-hypoglycemic drugs in patients who have high cholesterol. ठीक है. So you are trying to predict that if that patient had taken what you call anti-hypoglycemic drugs or hypoglycemic drugs, sorry, in time, let's suppose 2 years ago, if they had started taking anti-hypoglycemic drugs, their cholesterol levels might have been lower than what they already are. ठीक है, आप prediction बना रहे हैं यहाँ पे. ठीक है, अगर आप ये करते तो ये होता था, but you did not do, so you ended up with some other situation. Maybe you had that person had high blood cholesterol. ठीक है, वैसा आप प्रेडिक्ट कर रहे हैं. एक्सप्लेनेटरी डिजाइन में आप सिंपली एक्सप्लेन कर रहे हैं. एक चेंज करे तो दूसरा चेंज होता है या नहीं होता. So those are retrospective research designs. Now in the afternoon we'll do developmental research design. Okay, if you have doubts, if you want me to explain anything, please feel free to ask.